because even 5 to 10 millimeter reduction of the blood pressure brings down the vascular complications by 20 to 30%. It is a very rewarding treatment in diabetics, and we need to be specifically using a particular group of drugs when high blood pressure is present in diabetics. A group of drugs called like ACE inhibitors like enalapril, lisinopril. These are the drugs which are very useful in these diabetics to prevent complications. And very often the high blood pressure in diabetics cannot be controlled by just one drug. Combinations are required, and commonest combinations are calcium blockers like amlodipine or other newer calcium blockers. There are so many of them like cilindipine. So they are usually combined with ACE inhibitors or angiotensin receptor blockers like losartan, candesartan, olmesartan. So these combinations are very useful, not only to bring down the blood pressure but also to prevent many of the complications, especially the renal problems. These are the agents which can reduce the albumin or protein secretion from the kidneys. They stabilize the kidneys, they prevent progression of disease, they reduce the blood pressure, because if the blood pressure is high, the more and more albumin will come, because the pressure head is showing high pressure, so more and more protein will leak from the kidney. So reducing the pressure of the person is going to reduce this force which actually filters out these proteins from the kidney. So this is again a very important part in the total management. I already told you that diabetes and high cholesterol are once again very often associated, and all the diabetics need their cholesterol, bad cholesterol levels like LDL cholesterol levels to be brought down to low limit levels, and we want the LDL cholesterol levels of diabetics should be at least less than 100, preferably less than 70, and that again reduces the vascular events, especially if the patient of diabetes has already got a heart attack. The lipid levels are to be kept at very low levels, and we have very good drugs these days. We have statin group of drugs, atorvastatin, rosuvastatin, which both are high intensity statins. They are very important in preventing vascular events, especially in persons who already have had a heart attack, but also in persons for primary prophylaxis. That means persons to prevent a heart disease to occur. So we very often recommend using this group of drugs in these patients in order to reduce the complications. Then high triglycerides, low HDL cholesterol, once again are very important. Very high triglycerides in diabetics very often means uncontrolled diabetes. So by controlling the diabetes, by giving them all the instructions which a diabetic should be getting, which I'll be talking about in a while, should be applied very aggressively, and they include lifestyle management, which is extremely important, and also important drugs which can be used in this group of patients, and this is again very important. Now, how to suspect diabetes in a person? If it is for general public to understand that a person who gets fatigued, who has constantly losing weight in spite of having a good appetite, who is getting infections again and again, who is has to go to the toilet very often, especially at night, nocturia. These are some of the symptoms, because there is no specific symptom of diabetes, but these are the symptoms which one can think why are they coming, and blood sugar should be done in these individuals so as to diagnose diabetes. Previous drugs which we used to have were reducing the blood sugars and reducing some of the microvascular complications like renal kidney problems, eye problems, but they were not actually reducing heart failure, they were not reducing heart attacks as effectively as we wanted. In fact, they had very little effect. So we have now two new group of drugs. One group of drugs comes under the heading of SGLT2 inhibitors. These are the drugs which act on the kidney and increase the excretion of sugar from the kidneys, as a result of which the urine of the person who takes these drugs will have a lot of sugar. That is the reason we don't promote examination of urine to diagnose diabetes or the severity of diabetes these days, because these drugs are very frequently given. And these drugs reduce the chances of heart failure very, very significantly. Even those patients who have no established heart disease, they just have risk factors, high blood pressure, diabetes, and maybe a family history, and some similar risk factors like age and obesity. So these drugs, which are available, at least three drugs are available: empagliflozin, canagliflozin, dapagliflozin. There are three drugs which are available in our markets, and very frequently they are used and actually, according to many guidelines, they should be one of the first choices after metformin-like drugs in patients with diabetes, because they prevent the onset of heart failure in these patients considerably. Similarly, there is another group of drugs called the GLP-1 analogues. These are at present mainly available as injections, and these are very useful in diabetics who already have had a heart attack or have had a stroke in the past, because these drugs reduce recurrences of heart attacks and strokes, which are frequent. And these drugs, one of the common drugs is liraglutide, which these drugs not only reduce the blood sugar and vascular events, they also reduce the body weight, because many of these patients are obese and they can reduce the body weight by 5 to 10%, which is a very effective side effect of these drugs. So SGLT2 inhibitors and GLP-1 analogues have really improved the management of diabetics in the recent times. About a year ago or 2 years ago, we used to say that every diabetic should have a tablet of aspirin. Now it is very conclusively proven that giving aspirin does not bring any benefit to the diabetic, unless the diabetic has had a heart attack, has a known cardiac problem involving the coronary arteries, and that is not primary prevention, then that is secondary prevention, for which aspirin is still useful. But for primary prevention, it is no longer useful, because if there is some benefit, there is also some harm, like bleeding. So the benefit is over worked by, or negated by its side effect of bleeding. So it's no longer true that every diabetic should be on aspirin, unless the person has got vascular problem, coronary vascular problem. Then some people felt that maybe aspirin is not good enough, let us give them clopidogrel, which is another antiplatelet agent. But recent studies have again clearly shown that they again are of not much use. They all increase the chance of bleeding but do not give enough protection. So once again, antiplatelet agents like aspirin, clopidogrel or ticagrelor, they are all meant for people who already have suffered a heart problem, have had an angioplasty, have had bypass surgery in the past.